Hey, you have to like go with me here. Got my voice back, which is an absolute bonus. But I've been meaning to do this for like the last couple of days. Got my voice back a couple of days ago. So by the weekend, I was a bit kind of gruffly. So yeah, but yeah, it's been a weird kind of few days, and it is like stupid o'clock in the morning, and I've been meaning to like do this, and then I forget. So I decided that I'm just gonna get on with it. Otherwise, I will forget, and this won't get done for, and this video will not go out for another God knows how long, because I just keep forgetting to do this. Quite literally, keep forgetting to do it. So while I remember, literally while I remember, I thought I'd just get on with it. Literally, just do this. So, yeah, this video is on things called a neurocutaneous. If that's pronounced right, I don't know if it is. It's spelled neurocataneous. Neurocutaneous, I don't know, syndrome. Okay. Now, it's not one thing. Now, when I researched all of this, I researched it purely because I didn't understand the term. It was a word I came across in a book that I was reading. I read a lot of like psychology books. It's kind of my thing. It's what I like. It's what I enjoy. And I'm currently reading one on rage, madness, and the daimonic. Absolutely incredible. And I came across this one word. So I looked it up, and it's a syndrome, funnily enough. But it doesn't mean one thing. It's not an illness in itself. It is an illness, it is a condition, but it doesn't mean one thing. It's not a syndrome all of itself. You know, if you turn around and say, I've got this neurocutaneous syndrome, it can mean more than one thing. The very definition of this is it's a different disorders of different things. It can affect any part of your body, from your brain to your organs to, you know, it can affect everything. You know, it can give you developmental issues, learning disorders, you know, it can give you tumours, you know, benign tumours from what I've learned. It can give you benign tumours, to hearing loss, seizures. It can cause seizures. It can affect your bones, your skin, your organs, your eyesight. It can affect everything. And it can affect both adults and children. If it affects children, you're born with it. It's something you're born with. But there are conditions in this that affect you as symptoms start when you're adults rather than children. But they have found that if your symptoms start as children, it's something you're born with. It's a birth defect, or it's a birth defect, I suppose. And when you're born with it, it's most common. First symptom you find is on your skin. So you're born with a skin issue, either with a skin growth or like a birthmark or some kind of skin disorder. They have found, though, that there are three most common ones of these. I'm going to call them NSs because it's just simpler, because I can't keep pronouncing that weird word. There are actual three of these that they find are the most common ones of these. And they are, and when I first saw this, I thought it said tuberculosis, but it doesn't. It's tuberous sclerosis. Get your head around that. All these weird words that are like stupid, ridiculous for this time of the day. Otherwise known as TS, which is much easier for me at like 5:30 in the morning. And neurofibromatosis, I can do that one. Neurofibromatosis, I can do that one. And there were 2 types of this one. Well, actually, no, there were 3, but I can't pronounce the third one at all. Couldn't even spell it. The fucking thing was just like, no, didn't even want to go into that one. There were 3 types of this one, but the third one was just like, no, too long, too whatever. I was just like, no, head was beginning to hurt. So there were 2 types of this one that are like the most common, and that is NF1 and MF2 that we're actually going to talk about, because the third one was like, my brain kind of shut down after that, and it really did. My brain went, and even after like going back over it like several days of research, every time I got like past NF2, my brain was like going, brain was like, what? That doesn't make any sense to me. What is that? So I skipped past the third, neurofibromatosis, and just went straight into like the Sturge-Weber disease. I was like, no. So you can look into it yourself. Look it up yourself. It's like, yeah. But it is insane. Neurofibromatosis, there's a lot of information out there. I did manage to get my granddad's book back briefly from my uncle, but he won't let me have it for very long, which is kind of annoying. I need to get one for myself, but I keep forgetting, so I keep borrowing that one. But he won't let me hold on to it for very long because he likes looking at it and he likes reading it. So it kind of does make things a little bit harder, but there is a lot of information out there. So yeah. So there are 3 types that are like the most common, and they are TS, NF1 and 2, and Sturge-Weber disease, that I'm actually going to talk about, because yeah. When I was looking all this up, and when I was doing a lot of research into this, I had all this ready to go before I lost my voice. But obviously, yeah. Then obviously we all know what happened. So it does affect, these 3 actually do affect children mainly, but NF type 2 actually does affect adults pretty much. It doesn't affect children. It's the only one of these that does not affect children. So TS affects everybody. It just affects everybody. It doesn't matter where you are, what gender you are, where you come from. It affects everybody. But although this one isn't inherited, you can't inherit this one, it needs at least one parent to pass it on, which is really strange because they've actually found that there's only a 50% chance of a parent passing it on to their children, and only if that parent has something called a TD genetic gene in them, which isn't even the same. From what I've learned, it gets a little complicated after that. You have to look into like the actual genetics of it all to learn that the TD is not the same as TS, and the genetics that go with all of that are not the same, but actually they're all linked. Yeah, it gets exceptionally complicated when you get past all that, but TD and TS are linked. They're the same condition, but they're not the same chromosome, which is really strange. It's the same genetic, but it's not the same chromosome. It gets a bit kind of, yeah, when you get into the science of it all, it gets a bit complicated, and obviously on here I can't go into all of that, but do go and look it all up. Just go and look all into it all, because it is really fascinating. Just gets a bit complicated because it is all the same thing, but it's not actually the same. Yeah, it's just don't. But if they have a TD, if they have the TD genetics, you have a 50% chance of passing TS onto your children. But what is really fascinating about this is only you can pass it on to all of your children, but they found that actually you only generally, as a rule, pass it on to one of your children. If both a parent and a child end up with symptoms of TS, they're exceptionally mild. They're extremely mild symptoms, because they have found that it's more common for one child or one person in a family to actually exhibit symptoms of this condition. It's not normal for more than one family member to actually have symptoms, even if more than one family member carries the gene. It's usually only one family member that actually has the mutated gene, because it's not inherited, it's just a mutated gene, which is what it is. That TS and TD are the same thing. They're not the same thing. They're just mutations of one another. Told you it gets really complicated, it gets really strange. It's the same genetics, just not the same thing. I don't know how to explain this without me getting banned off here. It's all mutations. The TS is just a mutation. It is. It's a mutation. TS is a mutation. I think that's the easiest way to explain this. And because I can't pronounce the actual thing, TS is a mutation. It's not an inherited condition, it's a mutation. I think that's the easiest way to explain this. And TS and TD are exactly the same thing, but they're not the same. If you have a TD genetic, you can pass that along to your children, and there is a chance that it will mutate into a TS condition. That's about the simplest way I can explain this without getting banned at all. Yeah. So yeah, go look it up. Seriously, it is fascinating when you look into the science of it all and the research of it all and the genetics of it all. But trying to explain it all sometimes gets a bit complicated. Because obviously YouTube doesn't like a lot of the science sometimes, because I'm not a medical professional, and because I'm not a scientist, and because I'm not all of that kind of stuff, and I can't do all that kind of stuff, like absolute proof and absolute whatever. It gets a bit funny with me. And the last time I tried it, it banned me. So I have to be really careful. So I try to stick as close to the facts as possible without going into any of the So yeah, look it all up. Go into the genetics of it all. The research of it all, because it is really fascinating. Now, neurofibromatosis type 1 it affects everybody, but you see it it's actually fairly common. It's 1 in 3 to 4,000 babies just in the US alone. And now we have the gene in this. It's chromosome 17. Okay, now chromosome 17 is the gene that is inherited This one is inherited, but only in 50% of the cases. Okay, so you can inherit NF1. So you do have to be really careful with this one. Although it is 50% of people that can inherit neurofibromatosis type 1. It's also, they know that it can mutate as well. Although it can be inherited, they know that it's also caused by changes in that one chromosome. So this chromosome can mutate as well. So yeah, this one kind of goes both ways. But it is 1 in 3,000 to 4,000 babies that actually get this condition. Whereas with type 2, you don't start seeing symptoms until you're about 18 to 22 years old. So this one's adults. You start seeing symptoms in this one as adults. And it's 1 in 25,000. So this one's less common. And at the end of the day, there is a chromosome in this one as well. So it's changes in chromosome 22. So we've got a chromosome in this one, but again, it mutates it. That's pretty much all they know scientifically about how people can collect this one, but they don't say that it's inherited at all. But with Sturge-Weber, they have no idea, absolutely no idea. The cases in this one are completely sporadic. That it just appears. It can just happen to anybody. There have been some cases where they found that it happens to family members, like it can happen within families. But there is absolutely no common factors at all. There is nothing to suggest that it's inherited. There is nothing to suggest that there's any kind of mutation. There is nothing to suggest at all that there is any kind of common factor to anybody that this occurs to. So they have absolutely no idea what causes the Sturge-Weber disease. It's sporadic and they do know it's a mutation, but they only know it's a mutation if it's in babies, in children. If they are born with it, they find a mutation in a gene and it's called GNAQ. If you find it in any other child or in an adult, it's not there. They don't know what causes it. If it's found in children and babies, they know what it is. They see a mutation in your genes. But they do know that it causes benign growths. And those growths are made of blood vessels. Gross. Not my thing. No, don't like it. Not a big fan of blood, to be fair. Don't like them. And to be fair, I've had my fair share of tumours and I really don't like them. I've had enough of them, to be fair. You know, I've literally had enough tumours to last me a lifetime. I really don't want any more. You know, I have enough things growing inside me. I don't really need any more. I really have an issue when people tell me that conditions cause tumours, especially benign ones. I've had enough things like cut out of me. You know, I think I've had 1 tumour, 2 growths, and a whole bunch of lesions so far. Which they're not nice. So I know how horrible it is when somebody's got like benign tumours and benign growths, and I'm not a big fan of blood. So blood vessels look horrible. But the weird thing is, despite these conditions, they are lifelong. And if you do get these conditions, they are completely lifelong conditions and they are horrible to live with. If you have TS, this affects your spinal cord, your lungs, your heart, your kidneys, your skin and your bones. It affects every part of your body. You will end up with growths in your brain and your retina. I mean, that in itself is horrible. It affects things like your intellectual abilities. So it gives you intellectual disabilities as well as learning difficulties. It will give you things like seizures, and developmental growth. It will stop your developmental difficulties. It stops a lot of things, and it causes a hell of a lot of issues. It's not pleasant at all. But the NF1 is a little bit. No. See, I don't know if this is a little bit better or a little bit worse considering what it does, because this is easier to see when you're born, because this one, it gives you a light brown patches on your skin. This one is all, TS is all like internal, I think. It's pretty much internal. Whereas NF1 is light brown patches on your skin, benign skin tumours, benign tumours in your organs and brain, and then you get coloured tumours on your iris. I mean, they're like tiny little coloured tumours on your iris. I mean, I've never even seen them. I don't think they were possible. But apparently, this one does. And then you get things like hearing loss, headaches, seizures, learning difficulties, things like facial pain and numbness. And it can also cause things like ADHD. This one, I mean, NF1 is literally all about tumours. So you get lots and lots of tumours everywhere. And I'm like, ew, no, horrible. I mean, does that mean you spend your entire life having tumours removed? And do they grow back? I did try looking all that up, but I get a bit grossed out and a bit kind of when it comes to tumours, because I think it's just like my own kind of with tumours anyway. I just don't like the concept of tumours. But with MF2, because you're adults, I mean, the other two, remember, they're children. With TS and FF1, remember, you can be born with these. You get them from birth. I mean, that's imagine if you're a parent of one of them. No. But NF2, you're an adult. And then you get things like cranial nerve tumours, which is the cranial nerve, it affects your hearing. It gives you hearing loss. So the cranial nerve, it sort of, that is where your hearing comes from. So it affects your hearing, gives you hearing loss. So you then get things like headaches, facial movement issues, problems with facial movements, usually down one side, balance issues, trouble walking, seizures, tumours around your brain and your spinal cord, and skin nodules. It's not as bad, but it's still bad. But the Sturge-Weber, now we've all seen them, people with the dark red or purple birthmarks across their eyes or one side of their face. Sturge-Weber does that. That is what Sturge-Weber does. The red or dark purple birthmark on your child's face by their eyes and foreheads, that is Sturge-Weber. It's a sign of Sturge-Weber disease. It can also do things like muscle weakness on that one side, changes in your vision, but it's usually on that one side where they've got the birthmark, and seizures. It's pretty much, if they have issues in their face, it's usually down to the one side where they have that birthmark. But yeah, and things like changes in their vision, so they can end up with glaucoma in that one eye. Weird, but yeah. But that's pretty much all it really does. It doesn't cause learning disabilities, it doesn't cause intellectual issues, it doesn't cause developmental issues. It's all sort of in and around that one birthmark. The issues it kind of has, except for like the seizures, which are horrible because I have those too. The muscle weakness is in your face, and it's all down that one side where they have the birthmark, you know. So yeah, but to get this diagnosed, all you have to do is take the symptoms. If your child or you are having these any kind of symptoms like these that I've mentioned at all, obviously go to your doctor, go whatever. I mean, if you're born with it, you know, you're there anyway, you know. And doctors will ask for things like health history, developmental milestones. They need to know the health of family, so you'll need your entire family history. They'll do a complete physical, and then they'll order tests like genetic testing, which is a blood test. They'll order an MRIs, CT scans, biopsies of their skin, eye exams and EEGs, because pretty much all of these, they do have seizures involved. All of these have eye issues, you know, there's eye issues, there's scans for like, they'll need to look at your spines, your brains, your body, they need to look at all of this. So yeah, and if you are diagnosed with an NS, neurocutaneous syndrome thing, depending on your age and the severity of your condition, you know, and the health of your particular health as well, they will determine the treatment, because there is no cure. These things are lifelong. There's no cure for any of them. They will manage your symptoms. They will try to prevent and lessen the symptoms, and they will make the most of child's abilities. So you will have a primary carer. So if you are a child, you will have a paediatrician. If you are an adult, you'll have a family doctor. You'll be seen by a neurologist and a neurosurgeon. You'll have an orthopaedic surgeon, an ophthalmist, an oncologist. Then you'll see a nurse and a complete rehabilitation team, because a rehabilitation team involves things like speech therapy, physical therapy, you know, and all of those types of therapies, because you're going to need them, because you're going to need to, you know, obviously if you have developmental issues, if you have problems with your balance and walking, speech, anything like that, you're going to need that kind of team to help you. So there's no cure, but there is a lot of things that they can do to help you along the way. So I mean, this was kind of interesting to do, and although some of it was weird to kind of look into, and the genetics of it all was really fascinating. Yeah. Yeah, it was a bit kind of weird, and I have a massive thing with tumours. I don't like looking into it too much because I get a bit kind of creeped out by it, but I mean, that's my own issue, purely because my own experiences with tumours. So yeah, I'm going to leave it like that because this one's gone on quite a bit. So I love you all, and I shall see you all later. All right, bye.